Thank you for joining us. My name is Daniel Wolf. I'm the director of the Open Society Foundation's Harm Reduction Development Program. An increasing body of evidence, much captured in this report that we are releasing this morning, shows how police practices impedes health care, how experiences of police abuse correlate to increased risk of HIV acquisition for sex workers and people who use drugs and other criminalized groups. Less attention has been paid, however, to solutions or creative ways of addressing this problem. So this morning's press conference and the report is an attempt to move us forward just from problems to some consideration of practical, pragmatic, and important solutions. The report includes case studies from 5 countries that document how public health experts and the police are partnering to help rethink HIV prevention.
We are failing in controlling the epidemic in the most marginalized and in the criminalized populations, in contrast with the remarkable progress that has been achieved globally in the fight against HIV. Among these criminalized and marginalized populations are people who use drugs and sex workers, and that's the focus of the attention today. You may know that among people who use drugs, globally, 1 in 5 at least is infected with HIV, 2 out of 3 is infected with hepatitis C, and rates of co-infections range somewhere between 70 and 90% in that population. In Eastern Europe and Central Asia, we're witnessing the fastest growing AIDS epidemic in the world, and that epidemic is driven by unsafe injection among people who use drugs. But Eastern Europe and Central Asia is not the only place in the world where this is happening. We see this across many countries in Asia, and if we look at other places in the world, including in Africa, everywhere the prevalence and the incidence of HIV among criminalized populations is by far higher than in the general population. Now, laws and policies, the legal environment and law enforcement are actually an important factor, an important reason why this is happening and why people do not access services. At what I call the macro level, the legal level, many countries, despite the evidence, continue with harsh penalty, prohibitionist policies that we know are associated with elevated risk behaviors. But at the community level, on the ground level, it is about policing. And it is about the relationship between police, law enforcement, the health sector, and the communities. And as Daniel just said, and as you will see in the report, there is ample evidence that policing practices such as arrests for drug possession or syringe possession, client harassment, using condoms or condom wrappers as evidence of criminal wrongdoing, random urine testing, or extrajudicial practices, behaviors such as extorting bribes, physical or sexual violence. All of these obviously directly and negatively impacts on behavior, perception, health outcomes of people who use drugs, sex workers in the communities. In Ukraine, it's been shown that the fear of arrest is actually one of the key drivers of the epidemic, and many such examples have now been documented. And this is why, as we all have to advocate for drug policy reforms, for legal changes that will build the enabling environment that we need, we also need to rethink the relationship between law enforcement, health sector, and communities. We need to rethink our law enforcement strategies, and that is what this press conference is about. It's about building bridges. It's about shifting the environment from one that targets vulnerable people as the object of enforcement and exacerbate risks to an environment that will actually promote health and safe communities. So I look forward to listening to my colleagues. This is the outcome of a session we had yesterday afternoon. This is also the launch of the report Daniel mentioned to you. Please think about innovative, non-expensive strategies that can really save lives on the ground.
Thank you, Michel. And yesterday I was struck by a contrast. As public health experts, we often refer to sex workers and people who use drugs as so-called hard-to-reach populations, but the reality is that the police in many countries seem to have little difficulty in reaching them. Unfortunately, they often reach them with punishment and fear, and no health system can work. No AIDS target can be reached if people are afraid to use the services for fear of arrest. It struck me yesterday that reform of police practice in some ways is as critical to HIV prevention as a clean needle or a condom.